Well, good morning. My name is Bruce Thomas, and I am a global health consultant, primarily for the Bill and Melinda Gates Foundation, but also with Unitaid, the Stop TB Partnership, and with Novartis. I am a specialist in medication adherence and in differentiated care. And today I'm going to be talking about how an understanding of adherence behaviors can help TB-affected persons have a more concordant experience. So let's start here. We know that TB is treatable, we know it's curable, and yet in many high-burden regions, health outcomes remain suboptimal. Here, as we can see from cascades of care in both India and South Africa, a significant number of patients drop out or have unsuccessful transitions from proper diagnosis to inappropriate treatment to cure. And it's even worse for persons affected by drug-resistant TB or persons co-infected with TB and HIV. So obviously there are lots and lots of opportunities for improvement. We'd love a vaccine, we'd like better, shorter regimens, we'd like more point-of-care diagnostics. Fortunately, many of these things are finally on the way. But in the interim, we can, and in my view, we must give TB patients what they deserve: more patient-centric, more differentiated, more concordant care. And on this front, we're making real progress. So what I'd like to talk about today is an important segment in the patient journey, this medication adherence piece, keeping properly diagnosed patients who are on appropriate treatment, taking their medications until they are cured. I want to talk about how we can use new patient-centric tools to capture detailed information on how each person takes their medications, their medication-taking behavior, and lastly, how an understanding of these behaviors can be used to create a more concordant experience and better health outcome for TB-affected persons. And on the right-hand side of this slide, you'll see a definition of concordance. It's a doctor-patient relationship that combines shared knowledge, trust, support, and most importantly, shared decision-making. So we'll talk more about that. A few key points on this slide. So first of all, we know that adherence to TB treatments is essential. How essential? The slide on the right shows that medication taking in TB is imperative. TB treatments are incredibly unforgiving to poor adherence. If you don't take at least 90%, you're more than 6 times more likely to experience recurrence. That's the slide on the right. The slide on the left is Dr. Beena Thomas's information from India that shows this relationship between irregular adherence and TB recurrence. And we know that baseline adherence is low. And some of the reasons for that are, first, adherence is a multi-factor behavioral issue. It changes over time. But in TB in particular, the regimens are long and complicated. The dosing is very confusing. There's side effects to the medication. And unfortunately, some of the things that we have tried to help facility-based DOT may have been counterproductive in that it's burdensome on patients, it's inconsistent with their lifestyle, and it's stigmatizing. The good news is that we finally have given patients custody of their own medications. With FDCs, that shift has taken place. And as we do that, we're using new digital adherence technologies to support these self-administering patients and to capture some of their dosing histories. These dosing histories, which are really adherence vital signs, and I'd love us to begin using that word, can be used to continuously triage TB patients, leaving those persons who are adherent alone and prioritizing those who are having adherence-related issues. And secondly, we can use these dosing histories, these behavioral insights, for more personalized, more concordant care. And in the chart on the right, you see how this works. So here, this patient, the green boxes, has been highly adherent. Then the patient becomes non-adherent, the red boxes. We reach out to that patient. We have a conversation with that patient. We learn that that patient is having side effects. We coach them through those issues, and the patient returns to effective adherence and self-administration. That move from trying to control patient behavior to coaching patient behavior is what we're looking for. So why do we think that this approach is desirable, is more concordant? So the approach is very low patient burden. Again, we give patients custody of their medication, and we largely leave them alone unless they are demonstrably having issues. These vital signs, these adherence vital signs, are shared. Providers and patients can see that information. These dosing histories, these vital signs, provide critical behavioral insights that can be used for discussion between the patient and the provider. What challenges is the patient experiencing? What steps can be taken to mitigate these challenges? And this sort of enhanced counseling, as you can see from the chart on the right, really works. So the blue line shows the improvement in adherence that occurred after this enhanced counseling. So again, it's low patient burden, it facilitates a discussion, and it works. So just to tie it back to this concept of concordance, this approach, this knowledge of adherence behaviors helps create concordance. As shown on the right, again, knowledge, trust, shared decision-making. The approach that we're discussing shares information to establish a shared knowledge base and to establish trust. It facilitates a discussion that helps patients feel supported and make informed shared decision-making about their care. It's behavioral counseling. Nothing, in my view, is more concordant. So in conclusion, we're making great progress, I think, in this shift from controlling behavior to coaching behavior, from this one-size-fits-all to this more personalized approach. These new patient-centric digital adherence technologies facilitate that progress. We must strive to, and we now can, deliver to every TB patient more differentiated, more concordant experience across their entire medication-taking journey. We've made a good start, but much, much more work and much, much more innovation remains urgently required. So I thank you for your time today. Thank you very much.